Good morning and welcome to today's webinar brought to you by the New York State Association of Counties in conjunction with the New York State Department of Health. My name is Stephen Aquario, the Executive Director of the New York State Association of Counties. And today we're doing a webinar on building your county's EMS plan. This is a NYSAC Department of Health webinar on the new county-wide planning requirement. Today's webinar comes at a very important time for emergency medical services across our state. And based on the attendance of today's webinar, over 200 people, county officials from across the state, it's self-evident why. This is obviously, in addition to volunteer fire, EMS service is a matter of life and death in your communities. As many of you know, last December, the state enacted a new requirement directing every county to develop and submit a comprehensive county-wide EMS system. I want to thank our Governor Kathy Hochul, for her leadership and her vision, and the state legislature for their work in crafting this law, respecting the role of county governments. That plan is due, or this plan is due, to the Department of Health by December 19th, 2026, which is part of the reason why we brought everyone together during these midsummer months. This comes at a time when communities across the state are grappling with the real strain on their EMS systems, declining volunteer, rising reliance on paid EMTs and paramedics, difficulty recruiting, retaining qualified EMS personnel in a competitive labor market, reimbursement structures that don't often cover the cost of true readiness and care, growing calls for service alongside an aging infrastructure and equipment, and the challenging of coordinating across multiple municipal, volunteer, and private sector boundaries and providers that were never designed to operate as a single system. Today, we'll explore what this new planning requirement means in practice, the guidance the State Department of Health has made available, and how one county, Ulster County, has already approached this work long before this new law. Our goal is to give counties today a practical, grounded look at what a compliant countywide EMS system needs to include, the framework, documents already sent to county EMS coordinators, and what to do if yours hasn't received them. And a real example, again, of Ulster County, how they built their own plan from the ground up. We have a strong lineup of presenters who will walk us through both the requirement and how it plays out on the ground. We'll hear from the State Department of Health, who walked through the new planning requirement, the December 19th deadline, the framework documents that are already in hands. Then we'll hear in the county's hands. Then we'll hear from the Ulster County Executive, Jen Metzger, and the Ulster County Emergency Services Commissioner, Everett Erickson, and how they built Ulster's own countywide EMS system. And then we'll close with a Q&A session. And we encourage you to enter your questions throughout the session into the chat, right into the chat box on your screen. Before we get to the Health Department, let me go to Jeanette Stanziano from NYSAC to go over some housekeeping issues. Jeanette.
Thank you, Steve. We just want to make you aware that we are recording this session and we'll be posting a PDF of all the slide decks as well as a link to the recording at the conclusion of this presentation. We want to encourage you to submit questions at any time during the webinar by typing them actually into your questions tab. Actually not the chat tab, but the questions tab. And then we will address all of these questions, as many as we can, during the Q&A at the conclusion of the presentations. Back to you, Steve.
Okay, thank you. And again, after this webinar, we will not only post this webinar link, but we'll also post other Department of Health links. That is where counties should pay attention to the most up-to-date information that's being made available by the state, linking to the New York State Department of Health website. So before we get started, I want to thank Commissioner McDonald, Governor Hochul, again, members of the state legislature, Assembly Menottes, Senator Mayer from Westchester County, their great work on shaping this new law that we're talking about today. But I really want to thank the health department for partnering with us today on today's session and for their continued work for counties as this new requirement takes shape. Let's go to Ryan Greenberg, the State EMS Director from the New York State Department of Health, and let's hear what the health department has been doing, is doing, and what counties should be aware of. Ryan.
Thanks so much, Steve. Thanks everybody for joining today. Really excited about this topic. Here with me as well is Mark Hennessy, who's Deputy Director within the Office of Primary Care and Health Systems Management, as well as our Associate Commissioner of Office of Governmental Affairs, Alyssa DeRosa, and some more of our State EMS team, two of our captains that will be working on this project as well, Brian and Chuck. So a lot of information to go over in a period of time here. And like they said before, as we go through it, if you have questions, please put those into questions and answers section, and we will, I think we're going to be doing all the questions at the end. Stephen is going to help with that part. I'm just going to share my screen here. Give me 1 minute. And if someone can just confirm what you see is the PowerPoint.
Yes, we can see your screen. Thank you, Ryan.
Terrific. Thanks. So, with the county plan and this framework, it's been, kind of coming around for a while now. And with this plan, it is all about putting together a plan. It's about looking at the system. It's about understanding what your system looks like today and, opportunities for the future. So where this came from, there are two important components in where this came from. And that is the General Municipal Law 122B, which is the part that says that a county is going to write a county EMS plan. And then the second component of it, which is under Public Health Law 3019, which is the part where the department will work with other stakeholders to create a framework. And I think it's important to understand, too, this framework was created with a lot of partners. So one of the biggest, two of the biggest partners on this one were the County EMS Coordinators Association. So we worked with the County EMS Coordinators on what they felt should be in the framework, what their thoughts were, as well as with a large amount of work from the State EMS Council and the legislative committee from there who worked on this to help create that framework along with it. So what's the purpose of the framework? The purpose of the framework is to look at the EMS delivery models in your area. And, if we look around the state, every county is a little bit different, every delivery model is a little bit different because the needs are a little bit different. And that's absolutely okay. There's no one, way to deliver EMS in New York State. There's lots of different models that work, but this is about looking at it. What is it? How do we deliver EMS in your county? We look at service levels. How is different levels of service delivered? So when we talk about basic life support or advanced life support, some people know it as EMTs or paramedics. And then looking at those service gaps. Does every part of your county get the care that they need? Or are there some areas of your county that maybe have a gap? They get an ambulance, but they can't get paramedics. Looking at that and being able to put it on paper. When we look back today, if people turn to me as a state EMS director and they say, well, where exactly are those, gaps in paramedic care? We can't specifically tell you where they are or when they are. So this is about looking at that map, being able to, determine what that looks like. Looking at your EMS agency structures, commercial services, nonprofit, municipal. We have lots of different models, lots of different deliveries models. There's not, one that's, right for everywhere in the state. And it's really the collection and the collaboration of all of them that, makes the system work. But this is about, looking at that system and putting it all together. And those coordinated decisions is what comes next. When we talk about all those different systems, all those different agencies working together, how do they work together? Are they communicating well together? We have lots of really good resources in place today. We just want to see what we can do to strengthen them, to strengthen that collaboration, strengthen that network, and strengthen the delivery models. And then the last part is just, putting the plan together, the submission and the feedback that will come after that. So when we talk about that, and Steve talked about it in the beginning, this was enacted on June 19th this year, and there's 6 months from that date to submit your county EMS plans. So that those plans should be submitted by December 19th. Now, if your plan is done before then, we would love to see it before then. But we ask that everybody have their plan submitted by December 19th. We have, coordinated the delivery, the submission of the plans all through one system. We'll talk about that a little bit later on, but we made it as easy as possible where you submit it once, and then there are 3 different groups that will get it. That's the Regional EMS Councils, the State EMS Council, and the department. And that's by statute when we read through it. But what we wanted to do was make it as easy as possible for the counties. So all the county has to do is submit it to one place, and then we will coordinate getting it to each of the others. So if we look at the plan, and everything I talk about today is online, these slide decks are going to be shared online, all the materials are online, and we're happy to answer any other questions. But when we look at the plan, it's important to understand the first part, which is there's core plan elements and expanded plan elements. The core plan elements are the things that we feel in each of the 10 sections you absolutely should touch on. You absolutely should be talking about, you should be looking at, you should be discussing with your stakeholders. You should be, kind of working through those. The expanded planning elements are the components where if you have the information, if it's information you're tracking today, if it's information you're working with, that you should focus on those, that you should absolutely include them in your plan. But if you don't, maybe that's something for the future. Maybe that's an opportunity to look at in the future and things like that. And as we go through this plan too, and, there's been discussions on, well, who writes the plan, things like that. The county is the one who's responsible for writing the plan. The County EMS Coordinator is normally the lead in it. The department is here to partner and help in many different ways. And we'll talk about that as we go through the plan. We meet with the County EMS Coordinators on a weekly basis. So every Wednesday, we're meeting with County EMS Coordinators, seeing what questions they have, seeing how else we can help. One of the things that has come up in their assistance is surveying the EMS agencies to find out certain information that they would like to include in their plan. And the County EMS Coordinators came together and said, well, if the department can help with that, that'd be great. So we did. So we worked with the County EMS Coordinators to come up with a survey. We then have sent that survey out to all the EMS agencies. And all the EMS agencies, as they send that back, it's directly sent to the County EMS Coordinator. So at the point that they hit submit through our system, it will go to the EMS Coordinator on file, which also means if your county hasn't been a part of some of the meetings or changes EMS coordinators, or you want it to go to a different email box, just let us know. Myself or Brian or Chuck on this call are happy to help coordinate that and update any information that needs to be updated. So like I said, with the plan, we have the core plan elements and the expanded plan elements, and you'll see this same look going through the entire slide deck, which is the same look that we have in our framework. So these are the sections of the plan, as well as some of the appendixes, and we're going to go really quickly through each of the sections. Just due to time, I'm not going to get too in depth in it, but we just want you to understand kind of what the information is that the county plan should have. So the first one's the county overview and the system description. This is looking at your county as a big system and saying, this is what makes up our system. This is what's in our plan. What's the geographic size? What's the population mix? How many towns and cities do we have? What's the residential population? Because we know in certain areas, daytime is different than nighttime. Those should, be shown in your EMS plan. Why? Because it affects response. It affects, what resources you would need in a given area. And then, kind of that high level description of what are the different systems in your county. Is it all nonprofit EMS agencies? Is it predominantly municipal services, commercial services? Are you heavily reliant on volunteers versus career services? And by the way, when it comes to this plan, volunteer career doesn't really matter. If you have that really strong volunteer agency that gets out every time, that staffs their ambulances, fill in the blank, whatever it is, that isn't as important if they're paid or not paid as it is, are they getting to the cause? Are they getting to the patient when they need to be? Or is there a gap there or something that can be filled in? When we talk about that system and we talk about the expanded elements, like I said, here are your core elements. The next slide, this slide is your expanded elements. We talk about, what does that daytime workforce look like? Does things start to change? Do you have air medical services? Are you limited on that? Maybe you're limited on that because of weather certain times of the year. Those would be some of your expanded elements. If you have the information on, they'd be good to have in it. When we talk about your EMS resources and your coverage analysis, one of the things the department's going to do with this is we're going to provide you whatever information we can to your county EMS coordinator. we're going to provide, here's a list of the agencies in your county. Here's a geographic area that they have a certificate of operating authority to operate in. Any of that information that we keep in our databases that we can provide to you, we're going to provide to you. And we're going to hopefully have that be a tool for you in putting together your plan and writing your plan and having that information in your plan. So as we start to look at it, though, we start to identify the EMS services in the area by municipality, by geographic zone. One of the things it asks for is, do you identify who the primary EMS agency for a given area is versus the backup EMS provider, mutual aid provider for a geographic area? It talks about the models. It talks about, have you identified in your county, or can you identify in your county any areas with maybe limited or inconsistent coverage? And there could be very, clear reasons to it. We look at certain geographic areas in New York State, and, it could just take a long time to get to a geographic, point in your county. That's okay. It's just about documenting. It's about putting it in and saying, yes, we know that this is an area where, it takes us a little bit longer to get there because there's one road in and out, or whatever that might look like. It talks about staffing and availability. Again, you'll hear the term staffing coming up a lot. That does not mean career staff. That is staffing an ambulance, whether that be with volunteer, whether that be with paid, whether that be a hybrid. Maybe it's a paid provider and a volunteer driver. Whatever that looks like, it's just about you and your county and being able to put that onto paper. And then identification of any geographic areas or maybe some time-based service gaps. When we talk about the expanded elements on this side, we talk about coverage areas, maps or zones, maybe overlapping responsibilities. And again, if you can get to expanded areas, they're great, but the core elements are the real part that we're looking for on what we hope will be a living document in the future. And this will be, kind of round one. So we talk about the workforce. We know the EMS workforce, in certain areas is really strong, and in certain areas has some needs. And so again, the department will provide to the county EMS coordinator as much data as we can based on the information that we have. So we will tell each county how many EMS providers they have, how many EMS providers they have by level. We'll tell them, the different things based on the information that we have in our databases and sharing that. And then the county can take it and look and say, we think this is the right amount. We think it's, we think we need more in this category. That's a part of the analysis that the county really steps up. And because your counties, your areas, your geographic, kind of needs and what's there. We'll talk about staffing models, career, volunteer combination, just so that your county has an understanding of it. I think Steve mentioned in the beginning part, we know that volunteerism, is really strong in certain areas and struggles in some areas. Why? Because we all have that much more going on right now. We all have that much more that we need to, work obligations or family obligations or whatever that might look like. So we talk about identification of workforce challenges. Maybe you know exactly what's going on in your county and some of those challenges. Maybe you know that your challenges are specifically between the hours of noon and 6 p.m., but outside of that, you're able to really handle the volume and where it is. All good things, all things that we want to see in this paper, we want to see in your county framework so that you understand what those needs are. When we talk about the expanded elements, again, if you get to it, great. If you don't, no problem. But it talks about retention and advanced life support and mutual aid and some of those limitations that go along with it. Sorry for going as fast as I am. I just want to try and make sure I get through everything. We talk about call volume, demand, and dispatch. We will provide you information that we have, but this is one of those slides where the counties really probably have more information than even what the state does. The state has information based on the patient care report that's completed. It doesn't have information on what agencies were called to get an ambulance there. So if ambulance agency A was called first and they couldn't get an ambulance there, maybe they were tied up, they were on another call, whatever that might look like. And then ambulance B was called, but they couldn't get there. So ambulance service C was called. We won't have that information. So that's really county level information, probably from your 911 dispatch area that you'd want to look at from a local level. We talk about identification of 911 calls and dispatch entities. We talk about call prioritization. If someone needs an ambulance, do you just dispatch an ambulance, whatever closest, or do you look for the ambulance that is most appropriate for the call that's going, a basic life support ambulance or a paramedic level ambulance? We talk about mutual aid and how often is it being used. And then time on task. And this is important because every county is going to be a little bit different on this. That time from dispatch to the time clear is going to vary. Why? Because geographically things vary. Geographically, things are going to be different in different areas. And so even just transport times from a rural area to an urban area, those times are going to be different. And so it's important for the county to look and say, yes, this is normal for us. This is expected for us. Or this is taking us a long time. We should be looking at something. In those expanded points, we look at breakdown of response systems. We look at how EMD, emergency medical dispatch, is used, if it's being used. We look at mutual aid activations and then some interoperability capabilities. From an operational capacity and system performance point of view, we look at staffing models. This is some of that surveys that we sent out to EMS agencies. It asked the EMS agencies, are you staffed? Again, notice it didn't say paid or unpaid. Doesn't matter. But are you staffed? Is there a person that you know if the ambulance is needed, we know exactly who's going to be on that ambulance at a given time or a given day. We talk about how often is it staffed? Maybe they only staff at night, but they don't staff during the daytime. Maybe they only staff during the daytime, but not at nighttime. These are things that are on that survey that was created by the department and the EMS coordinators to ask the EMS agencies. And that is out with our EMS agencies now. We've already started to get responses to them. And we'll be pushing for all the agencies to respond by August 9th. And then, we'll probably see some come in after that as well. But, looking to get all those responses back. We talk about coverage patterns and operational needs. And then, medical oversight. How does our medical oversight look? On the expanded times, again, if you have that capability, how long does it take or how often, are units out of service or time on task in a specific subset and different things there. I would also say, we're going pretty fast through this, but this is an excellent opportunity too, if you haven't already, sit with your county EMS coordinator. For those of you who maybe are participating here, who maybe are an county employer, things like that, or you're part of an EMS agency or a municipal service that joined the NYSAC call, this is the time as a stakeholder to get engaged, to reach out to your county EMS coordinator and engage with them to be a part of this planning process. From an education, training, and workforce readiness, we'll talk about training availability. We'll talk about CME availability, which allows for renewal and retention. We'll talk about agencies' training practices. Again, some of this asked in the survey to try and understand what it is to look at, because this is about engagement. It's about retention. It's about how do we keep the workforce moving forward and engaged. We talk about workforce impact. What's impacting the workforce in your area, in your county? We talk about, do we know what's bringing them in as well as what's retaining them to stay? And again, any information we have on education, we will also provide to the counties. We also are doing a survey to all the educational institutions, the EMS educational institutions, asking them to fill out a survey, and we'll share that with the counties as well. From a fiscal structure and EMS sustainability, this is a big component of what we think the plan is looking at to understand stability and where things are and where things are going in the future. So we talk about EMS funding, where that EMS funding is, what it looks like in a county, municipal or tax support if it's there, billing for services. We still have a lot of services that don't bill for services. But this survey and kind of this format that's going to the agencies is also about the counties understanding how those agencies are supported and what they're dependent on. We talk about, kind of where things are coming from, percentages and different frameworks of those different agencies, and also the financial pressures impacting different reliability. We've heard a lot lately, it's not something on our side, but we heard a lot lately about insurance costs and what it costs to insure an ambulance and the difference, today versus 10 years ago. We talk about operational funds and do they have operational funds? What's the sustainability of an EMS agency? Do they have enough in reserves? Should they need to go into reserve for some reason? Then obviously the expanded components goes into a lot more about readiness and capital needs and oversight, replacement of vehicles, and what an ambulance costs today versus what an ambulance cost 10 years ago. So we talk about emergency preparedness. In the emergency preparedness side, the county response expectations, the system reliability, what that looks like, what that plan is. How often are we getting out? Is an agency getting out for their first call And we say first call reliability because we know that if we go to a second call or third call, it might not be realistic for that agency to be prepared for that. Under that same thing, we talk about surge. We talk about, God forbid, there's a bus crash. We've had pretty significant ones recently, or something else. Can we handle an MCI? Do we have the resources that will come into play? From our community programs and outreach, we think this is an important part. Even if we find out that your county isn't doing any community outreach or things like that, it's just about knowing, well, are there opportunities here? Maybe some of this community outreach will help us in bringing in the next generation of workforce, bringing in the next group of people. And we have, a number of different things at the state level that we share with counties on different outreach programs that they can do. CPR training, hands-free only training, stop the bleed training. And also, when we talk about those community programs, what about high utilizers and populations and things of that nature? We talk about existing alternative response models. What is being done as an alternative model. We see some new models that have come into place, as well as the additional kind of care pathways and the expanded models. Section 10 is one of the most important parts, and this is kind of the summary of everything as it comes together. Your system analysis, your gaps, your strategic direction. So your system strengths and limitations, it looks at your system strengths and says, hey, we're really strong in this area. We have a really good workforce. We have really good this, but during the daytime, it's a limitation. We're looking at that. Whatever that might look like, this is what we want you to look at. We look at identification of service gaps. This is something specifically that the statute asked, is to take a look at what that is. Not only looking at what those gaps are, but looking to ensure, well, what would it take to fill those gaps? What would you need in order to be able to turn and say, we'd be able to solve that problem if we had this or if we had that. And so being able to take a look at that one. And then your strategic direction and priorities. Where do you think, things are going to go, into the future? That brings us to the last kind of component of the plan, which is, what are 5 anticipated short-term system improvement opportunities? And what's 5 long-term system improvement opportunities? And that's for you as a county to look at and say, hey, here's some things now that all the material is in one. We've looked at all the agencies. We've looked at the system. We've looked at planning. We've looked at what the future is. We've looked at sustainability and how many of our agencies, have the financial sustainability or, kind of where that is or what we need to do. And then taking a look at that and coming up with some opportunities on what the short term and the long term is. And you'll notice our short term is 12 to 24 months. It's not 2 to 3 months. Why? Because this didn't happen overnight. We're not going to solve a problem overnight, but we need to look short term and we need to look long term in that. And I think you'll hear a lot about that short term and that long term in the next presenter as the county executive comes up in a few minutes, as well as what's going on in Ulster. So just in closing, there are a couple of appendixes and attachments I'm going to show you in a second. But this is the inventory maps, it's the detailed maps, it's response times and patient times, a lot of the information that we're going to provide, as well as some resource documents. So resource documents related to the EMS agency collection, the core sponsor data collection, municipal data collection. I will say that the EMS agency and the core sponsor data collection, that's on us. We're sending those out. The municipal data collection is on the counties to send to their municipalities, and the EMS coordinators know that. It's just not contact information that we have. So in discussions with the County EMS Coordinators, they said, yep, this is something that we can handle on our side. Timelines and submissions. You saw this slide in the beginning. It comes right to the end. December 19th is the date that it should be submitted. If you have it early, we'd love to see it before then. And then the streamlining process to try and make it super easy for everybody to be able to submit and find things. If you go to our website, this is a picture of our website just to make it super easy. You'll see a yellow box on the left-hand side. It says State Programs, Councils, and EMS Reports. If you click on that, and then you click on County EMS Plans, you will come to a comprehensive page. It has all the documents, the framework, ways to ask us questions, submissions, all of that in one place. As far as submitting any county plans and anything else, back to our homepage, to EMS Forms, right to this page here. It will give you all the abilities to submit everything. Again, as you submit to us, we directly push that to the counties, specifically to the County EMS Coordinator. And that is everything I have in about 22 minutes. And Steve, I'm going to pass it back to you.
Okay. Thank you for all that you're doing, first of all, not just to comply with the new law, but your interaction with county EMS coordinators county fire coordinators, county administrative officials is truly appreciated. And I know that you're making a difference, and we're very grateful, Ryan, for all the work that you do there. And thank you for your presentation. Ryan, we have many questions, but I want to get to Ulster County right now so we can hear a live example of what a county had been doing prior to this new law coming into effect. With us now, we'll introduce the Ulster County Executive, Jen Metzger, longtime friend of myself, member of the state legislature, serving now as a county executive where she should be to use those talents and skills to help serve the people. Ulster County, of course, is one of our oldest counties that we have in New York State, going back all the way to 1683, one of our oldest counties in the state of New York. With us here today to talk about EMS, Jen Metzger, the Ulster County Executive. And Jen, I'll have you introduce your EMS coordinator as well, so he can get into what's going on in Ulster County. Thank you for joining us, Jen.
Thanks so much, Steve. And good morning, everyone. Thank you to NYSAC for bringing us together today on this important topic. And I also want to share a big thanks to Ryan Greenberg for his partnership with us that has been ongoing, and the other great state partners at DOH. We're happy to have the opportunity to share our work in Ulster County to address the major challenges facing EMS. Before we implemented our EMS stabilization and enhancement plan earlier this year, more than a third of our EMS agencies were responding to fewer than 70% of their calls, largely due to staffing shortages and financial strain. I'm sure this is going to sound familiar to many of my colleagues across the state. These pressures have been building for years. Fewer volunteers, rising costs, and a growing share of residents on Medicaid, which reimburses at far lower rates than private insurance. At the same time, our population of residents that are over 65 continues to increase. And that drives higher call volumes and more complex medical needs. These are not just Ulster County issues, they are statewide challenges, which is why the state legislature passed this important legislation in 2025 for directing counties to develop and maintain comprehensive EMS plans. In Ulster County, we had already done this work, adopting a $4.7 million EMS stabilization and enhancement plan earlier that year to close service gaps, improve response times, and bolster the quality of care delivered across our county. This funding, I want to note, supplements and does not replace the support provided by towns and villages in our county for their local agencies. We've also invested in building the core of trained EMS professionals that we need. We launched a highly successful county EMT training and certification program last year, and this fall, in partnership with SUNY Cobleskill, we're bringing their award-winning paramedic program to Ulster County. So before I turn it over to our commissioner to take a deeper dive into our EMS work, I want to just say something about the long-term financing of EMS. The days of us relying on volunteer agencies and community donations are long gone. If we want to stabilize EMS for the long term and do so equitably, it is my belief that we have to move toward, within Ulster County, within our county, toward regional taxing jurisdictions based on coverage levels. Ulster County is a large rural county of over 1,100 square miles, and the EMS demands vary across the county. A financing approach that takes this variation into account is really the fairest and most reliable path to ensuring that EMS can deliver the level of service our residents need for the future. So that is what we would like to work toward. So without further ado, now I'd like to introduce our Ulster County Emergency Services Commissioner, Everett Erickson. He and his team have done truly pioneering work in addressing EMS challenges in our county. So over to you, Everett.
Good morning, everyone. Thank you, County Executive. Thank you, everyone, for allowing us to be on this call and present on what we're doing in Ulster County. If the NYSAC team could put up the presentation, it'd be great. Thank you so much. So like the executive said, we've been doing a lot of work for a few years now on EMS, and truly we wouldn't be here without my team. Our EMS coordinator, Rich Miller, and our assistant EMS coordinators, Michael Beninati and Patrick Rose. They've done tremendous work on the thoughts that we have, and the information that we've been obtaining while working with all our EMS agencies in the county, with New York State DOH, as well as our contiguous counties. We're continuously having conversations with them as well on where they're going, how they're doing things, and we did do a lot of research going into this. So if we can move to the next slide, please. So it was really identifying the challenge. Every county is going through similar things here. This is just not isolated to us. And I'm sure, if you speak to other counties and other counties on this call, they're doing something. They're trying to do something. They're trying to make some type of headway. I think we all have the same goal in our counter departments here, that, we want to make sure that we're able to get an ambulance to the doorstep, serve the community, serve the residents, handle the calls. And what we were seeing is, there were times, and, let's just speak frankly, that we were seeing, calls, sometimes getting an hour to get an ambulance there. And that just became unacceptable. We couldn't allow that to happen. So we really needed to do a deep dive. And, we were diving into this internally. We also did an EMS study. And I know a lot of other counties have done that as well, just trying to gather the information from the EMS agencies when they're a county to provide just some backup on why we're making these decisions to bring to our leadership. And what we're seeing is workforce shortages, not enough EMTs, not enough paramedics, working in our communities, the jumping from agency to agency because one agency is paying more than the other, the amount of work that they're doing at that one agency. We're seeing a rise in call volume, and then, higher costs for operation. And we were also seeing a lot of, in Ulster County, uneven ALS coverage. We had, serious issues with that, where, towards the western portion of our county, southwest portion of the county, we were lacking ELS. So, we have about 20 agencies in Ulster County, that, 20 CON holders, and 7 of which are ALS CON holders. So, and they were just being overworked. They were sparse, and we couldn't manage all the call volume. Next slide. So, really taking the data and seeing what it reveals and making our decisions based on evidence and not assumptions. Sometimes, our heart takes over, and we really need to look at this, dig down into the data, ask the hard questions, and how are we going to improve the delivery. So we really started, doing a response analysis. How long is it taking in the different parts of the county regarding BLS and ALS? We started to heat map that. This map that you see here is from 2024. And, you look down the southern area of the county, where it was very, very red. And that's with ALS and BLS. The northern part of the county was just more of an ALS, larger ALS issue. So when we started to develop this the stabilization plan, we took a multiple prong approach at it. The first one was looking at, a supplemental ALS system. We do believe that these municipalities, these areas are providing a BLS coverage, but they're responsible for providing EMS coverage and the proper EMS coverage. So, we dispatch in Ulster County approximately 60% of the call volume as ALS. We also know that on the back end, after the call is closed out, it's actually about 45%, right? So how do we address that? We need to do better in EMDing the call, right? So we sit down and we start really looking at that, and let's try to not overlies ALS ourselves. Let's not be part of the problem. Let's try to find a additional solution there. So we work on doing better on EMDing the call, and we're starting to see a drop in that EMD of ALS and BLS. The other thing is, how are we going to get ALS ambulances to the call, right? So we identify strong ALS agencies in our county that are providing the service, and with some additional funding, we would be able to get them to pick up additional call volume, right? And that's where the $4.7 million comes in. So we split that $4.7 million between a $2 million bucket and a $2.7 million bucket. That $2 million bucket allows us to strengthen the BLS agencies, okay, in the county, help them stand up better, help them also work towards diminishing the ALS call volume. And then the 2.7 we use to really stabilize our ALS system and provide them funding. And that's when we go after our county CON and contract with them to provide an ALS service as a supplemental system. Again, we're still relying on the BLS agencies to, subcontract out, have agreements in place to where when it's an ALS call, they have somebody coming. But if they don't, or there's a second call, third call, we're able to pick that up with our ALS system. And that's the starting point. The biggest thing going into this, we knew, is that our plan needs to stay dynamic. Like the Director Greenberg said earlier, we have a 1 year, 2 year, 3 year, 5 year plan as we move forward through the whole process here. Okay. And then resource deployment. How do we, again, we sit down and we work with these ALS agencies to try to spread the call volume, identify, where their home agency is, what their territory is, and covering an area that's not too much, that we're able to get that ALS agency, that ALS ambulance there in a certain time period. Next slide. So once we identify all these high level goals, we start to put the plan together, and we sit down with the county executive and we start to pitch everything. And we have been very fortunate in Ulster County, where emergency services has become a priority. We understand that, people need ambulances, people need fire services, and people need to be able to call 911 and so on through all the emergency services. And we've really been supporting that. So with that, we sit down with the county executive to talk about how we need to really develop this sustainable plan. We explain our direction that we want to move in, and rightfully so, we get asked the hard questions. And we appreciate the hard questions because that's what's going to help us move forward. With that, we spent a lot of time conversing with Director Greenberg and his staff at the state. They have been such a wealth of knowledge. They've been very helpful to us in everything that we do. We worked with them through the entire process. So, we really appreciate that. There's no reason to cut them out. And they brought so much knowledge to us, especially when we started to develop our training program, where that was the last prong to the stabilization plan. Is we need to be able to develop our own. If there's a lack of training out there, there's a lack of EMTs. How do we develop that? So what we did with the training program was We got our core sponsorship through the state. We worked with his training bureau to do that. Pretty seamless, I have to say. And, you know, we started our first class last year. Our first class, we didn't graduate as many as we wanted to. It was a smaller number of 13, but the class right after that, we saw 25 graduates, right? So those numbers are now increasing. The other thing that we've done is, through the executive's leadership, we're able to apply a $2,000 stipend if you complete your certification, receive your EMT certificate from the state, passing the state exam, just not the class with us, and you are affiliated with an EMS agency that provides services here in Ulster County, we provide you a $2,000 stipend. And that has helped the increase. And that just wasn't invented by us. The state does that with New York State OFPC and our fire service, right? So just taking some things that are working other places and applying them to how we're going to try to fix our EMS problem in Ulster County. The countywide operating certificate, it really allowed us to take control of the calls. There's on the 911 side of the house, regarding the PSAP, there's always been a lot of conversation internally of, okay, who owns this call? Someone calls and needs help. Who gets it? And it always comes back down to home rule authority having jurisdiction and so on. And, with the county operating certificate and us subcontracting out services, there is no waiting. Okay. There is no more conversation regarding the fact that ambulance service A wants ambulance service B as their backup. And we all know sometimes that ambulance service B is not going to be available. So this gives us a little bit more flexibility. It becomes a lot more cut and dry to who we're going to dispatch now. And we can dispatch one of our sub EMS agencies that we have an MOU with to go provide that service. And they're being paid to do that. And then lastly, county staffing. That's always a challenge. We understand that across the board everywhere, whether you're in the private sector or the public sector. But we needed really good, strong representatives to help us move this forward. And that's where, our EMS coordinator, Rich Miller, and the assistant EMS coordinators, Michael Beninati and Patrick Rose, as well as, creating our education unit, being able to provide that training. We were doing that on the fire service side already. And that's what we created within the county is an education unit on the EMS side. We have great CICs and CLIs that are now providing this training. And we're really seeing an increase in the EMT students within the county. And not to say we don't have other core sponsors in the county, but there just wasn't the applicants. And maybe it has to do with $2,000. Maybe it has to do with the instruction. There's multiple things to take into account. Next slide. So within that $2.7 million, we were really investing in ALS, and we were looking at also, being that we were investing in the ALS side to provide the supplemental system. We have municipalities that do have strong ALS systems, okay, that are paying for it, right? So we need to offset that a little bit. So there is funding that was going back to some of the municipalities so they can offset that cost. Again, with the $2 million, we were strengthening the local EMS agencies. And then, we last year invested in the EMT program. Next step is investing in a paramedic program. So we were able to partner with SUNY Cobleskill and bring them here with us as a satellite campus to provide this training. That's starting up this August. We're starting off with a cohort of 15. Initially, it's going to be hybrid for this first semester. And then the second semester we'll have in-person, which would be January of next year, have in-person classes here with SUNY Cobleskill in Ulster County. And we already have a cohort of 15 students filled right from the start. So that was great. And then adapted conditions change. We need, again, like I said earlier, going into this, we knew that the plan needed to stay dynamic. This is not, okay, we wrote this, we have this, it was approved by the legislature, we're done. Nope, as things progress forward, we need to now take the next step, right? And that gets into the next slide, where we start looking at the regional system. So as you saw on that heat map that I showed earlier, the southern portion of the county, there was a really lack of ALS and BLS. We actually had a portion of our county where there was no ambulance service at all. And we were always trying to find an ambulance, relying on other municipalities to get that service to them, right? So, so we were looking at a more stable, sustainable system and sharing resources. So a few years ago, the town of New Paltz and the town of Lloyd actually started working together when it came to ELS and to EMS, and the New Paltz Rescue Squad was providing the services to New Paltz and Lloyd. And what we did is we took that and we started to expand that under the county CON. So New Paltz only has a CON for the town of New Paltz. So under our CON, Lloyd gave up theirs, we acquired ours, and we started providing the service to Lloyd, subbing it out to New Paltz Rescue. After that, we expand to Gardner. And now currently we're working on this for next year to include Plattekill. We're starting to have additional conversations with the town of Marlborough as well. And what this is doing is creating a more regional coordinated system through our 911 center. We're reducing duplication. What we were seeing here, we were seeing numerous ALS ambulances, numerous BLS ambulances, but the call volume didn't require that. And if they were to start to have to pay in a siloed municipal system, it just became, wasn't cost effective. So what we're doing now is under the county CON, we're providing the service coordinated, and we're looking at just this area alone, 5 ALS and 2 BLS ambulances, right? And this has already proved to work. We had just recently in the past 6 months, we've had 2 serious calls. We had a fatal fire in the town of Lloyd with trapped occupants, and they needed 3 ALS ambulances. Within 5 minutes, we had those 3 ALS ambulances on scene. A few weeks ago, we had a rollover on the New York State Thruway, which was a tour bus, 22 patients. Within the hour, we had 11 patients transported, and the other 11 that did not need to be transported were moved through with our UCAT bus, Ulster County Area Transit, to SUNY New Paltz, where they were able to do RMAs with New Paltz Rescue. Okay, so having these resources concentrated to this area, taking a regional look at this, has already started to prove itself over the past year. So we're very happy with that. Next slide. Thank you. So the other thing we need to do is we need to embrace technology. So like many counties, there's only a few that have numerous PSAPs, but we have one public safety answering point 911 center in our county. So everything comes through us, so we can manage that call volume. We upped our game when it came to EMD, emergency medical dispatch, of our calls, and we continue to review that, continue to hone in on that. We have our medical director participate in all our conversations. It's our EMS staff with our 911 staff, and we get down into them to really make sure that we're EMDing these properly, so there's not an over-reliance on ALS. We have continuous conversations with our core ALS agencies as well to see what they're seeing out in the field, just not what we're seeing behind the desk. Back in 2017, we developed a countywide public safety computer-aided dispatch system. So it's countywide. Everyone is using one system here in Ulster County: police, fire, and EMS. And then recently, last year, we've developed an AI quality assurance program. So we're using AI on our call volume to really QA our dispatchers and how they're EMDing the calls. But now we're implementing phase 2 of that, where we're using AI to evaluate the entire call, right? So what AI is going to do is it's going to start to look at the call itself and after response and the EPCR and so on, right? So we're not just QAing the call as it comes in and how our dispatcher are doing. We're going to have a full evolution, a full review of the entire call and see where else we can improve. Okay. And right now, unfortunately, all our departments, all the divisions within the Department of Emergency Services are spread out in different buildings. We're bringing everyone under one roof, right? So now operationally, we're able to communicate and work better together. And we're supporting municipalities. We continue to support municipalities with county guidance for ambulance taxing districts, providing technical assistance, legal support, and standardized documents. So last year, we worked with the town of Gardner to create an EMS district. This cost was picked up by the county to move this forward. We're currently working with the town of Plattekill to do that, right? Within the next 30 to 45 days, that will be established. And we're working with the town of Marlborough as well right now to help them create that ambulance taxing district. These costs have been picked up by the county. Our EMS team goes out, meets with the local first responders. We meet with the town officials. Just in the town of Marlborough the other day, we were presenting and they had a lot of people. And I understand that sometimes these town board meetings aren't well attended, but they had a public hearing, so it was well attended. And we ended up on the agenda to present on creating the EMS district. And the community applauded my team. And it really comes down to, presenting it the right way. Our residents want EMS. We understand that it's going to cost money, but the residents, once they know that, these budgets that the EMS agencies are operating at are so small, and once they realize how much it actually costs to provide the service, they buy into it. Within the town of Gardner, there was, they were fully supportive of it. We received calls saying, thank you for helping us move this forward. This was really, really important. So just the key takeaways, you need to take a data-driven approach. The regional approach was our next step, and that's what we're currently working on. And we're going to continue to work on that, throughout the next couple of years to try to just expand what we're doing in the southern area of our county. We want to make sure it's sustainable, and we truly believe that this is a sustainable way. We need to invest in our people. We need to make sure that they're being educated to provide second to none service to our residents. We are in public service, so that needs to be our priority. And great leadership. And that starts right up at the top. Our county executive has been absolutely amazing with us to really give us the support and set us up for success. And her allowing us to be set up for success allows us to set our EMTs up for success, and allows us to make sure that our residents are being covered, with proper EMS coverage. And then lastly, definitely look at the documents, that Ryan was speaking about earlier. But if you want to have like a central area to kind of look at other county, EMS studies that were done and gather some additional information, some reports that have been distributed. There is one central place out there that you can really find a lot of good up-to-date stuff, which is NYEMSinfo.com. It's not on this slide, but it's on my slide on this end. So NYEMSinfo.com has a lot of good information out there.
Okay, I really want to thank Ulster County Emergency Services Director Everett Erickson, the Ulster County Executive Jen Metzger, for sharing, after 343 years later, Ulster County's continued dedication to the people of New York. Well done. We will do another session similar to this at the next NYSAC conference in September, the 28th to 29th of September, in Onondaga County. Team Ulster will be back there going through a similar presentation for county officials during the NYSAC conference. I want to thank EMS State Director Ryan Greenberg. All the accolades you've been receiving, Ryan, from the presenters here today, I'm sure is being echoed around the state. You just don't hear it. We're very grateful for the state's leadership role, for the state's assistance in this. Look, if you've seen one county with EMS and volunteer fire, you've seen one county. That's just it. Each county will have their own unique circumstances, situation, volunteers, paid situations across the state. We have a few questions. I think we should take 10, 15 minutes. I know we're at the hour here, but due to the timeline that we're trying to comply with here, we have a couple here for, let me start one for Ulster County. County Executive, how did the county raise the $4 million to support the program enhancement, stabilization? What portion of those costs are one-time versus ongoing cost? If it was money coming from property taxes, did it impact the state's property tax cap? And how did the community react to an increase? So I guess a legislator here is asking how you did it. What was the path forward that you used to generate that revenue?
Right. So, we budgeted for that and paid for it the normal way through, sales and property taxes, tax revenue. And we did a lot of public outreach and education about this. And we had been keeping, EMS pretty salient, our work on that for some time. And quite frankly, I mean, there was just broad support for it. There was broad bipartisan support for it. I think it passed unanimously in our county legislature. And everyone recognized that this was just a huge challenge that needed to be addressed. And as Everett said, when you explain it to people and they understand it, they know they need this service when they want an ambulance to show up at their door when somebody, if an emergency happens. So this is, I'll be budgeting for this again this year at the same level for now. But as I said at the beginning, it's really, our county investments are supplemental, are in no way meant to replace local communities' contributions, municipalities' contributions. And, we really, in my mind, communities need to be moving toward creating these, and it's happening in Ulster County. We need more of them to do it, but creating, special districts to fund EMS service. And I think that's very important because I think when people see right now, like the county share, that's just one line in a budget, but, when people are paying, see what they're paying for. When your residents see, I'm contributing to my, my EMS service in my community on their property tax bill, I think that that's important. That visibility is important. And I think that that helps get a lot of community buy-in. But ultimately, having those taxing jurisdictions ensures sustainable funding into the future.
Okay, thank you for that rational explanation. And a follow-up to that is, how long did it take to get before the legislature was and you were ultimately able to get the vote on that situation? And follow-up, how is it possible that you were able to get all the local PSAPs under one roof?
Well, the PSAP question, that happened before my time, so I'll let Everett answer that. But but it's been great. I can tell you that.
Mm-hmm.
It really did not take very long. I mean, we once our Everett and his team developed the plan, we shared it with the legislature. I think it took a few months, right, Everett? Would you say? We brought legislators in, really, made sure everyone was on board. And yeah, it did not take very long. What took a while was the work we did to develop this plan. I mean, we had an EMS task force. It was that was what year? That was also, Everett, before my time. I think it was 2022 it was started. But we have been working on this issue for some years. So had a lot of data and a lot of conversations with municipalities to inform this whole plan. So by the time we got to it, it was fairly seamless.
Okay, thank you, County Executive. Director Greenberg, access to biospatial. Access to biospatial and EMS reporting platform appears to be helpful to the EMS coordinators. State EMS provides access to county public health directors. The request from this webinar from your family is asking you to share that with EMS coordinators.
Yeah, I think that's, Biospatial is a platform that we are rolling out statewide. And like you mentioned, we have our county partners right now with the local health departments. And so that's step one with us with that. And I think in the future, we'll see that roll out to county EMS coordinators, possibly other stakeholders, as well as EMS agencies. So I think that's coming down the pipeline. I think that the focus at the current moment is, working on the data, getting those data reports out and the other things right now, and then kind of come back on this one.
Okay. Thank you very much. Please go
Could
ahead.
I add one thing to that? Yeah, if you don't mind. So first of all, I just also want to present to folks that as we've been rolling this out to the county public health officials, that's a cost-free rollout. It's a wonderful addition. It's a terrific platform, and we're getting a lot of really good notes. I also just want to recognize, I think the question came from Mike McAvoy, who we all know and have worked with over the years, who's our former State EMS Council chair. So I just wanted to give a shout out to Mike. We appreciate the question, and it's very well asked, and it's something we're thinking about. Thank you.
Okay. Thank you very much, Mark. What discussion and at what levels within the state has been focused on EMS becoming an essential service? What does that designation mean? Ryan, what does essential services mean? Does it mean it becomes a mandatory service that must be provided by a village, a town, a city, or a county? Is that what that means?
I think I'll let Alyssa touch on this first. I know it's been in some things, and then happy to add to it.
Okay.
Sure.
Alyssa.
Yes, thank you so much. I can speak on sort of the first part of the question about what's the status of current discussions for the state. And again, just speaking solely for the department here, as I think many people are aware, we have proposed legislation in the past that would make that designation, and that ultimately did not go through. I think at this point, our focus is really on the rollout of these county plans, and are really looking forward to, getting that larger picture and larger view of how services are coordinated throughout the state at the county level, and how emergency medical services are provided for all of the residents. So that's our main focus at the time. But I think, Ryan, you probably can add some more information.
Yeah, sorry, go ahead, Steve.
Please go ahead. I have another question. I was going to keep moving along, but if you want to follow up, go ahead.
Just quickly, I'll touch on that one. Essential service is, to a certain extent, it's a word, and it's some of that component of figuring out what's behind it. I think it's important to also recognize in these county plans, one of the questions that we've gotten is, does this mean the county has to start an EMS service? And the answer is absolutely not. This is about putting on paper what is in your system, working together, bringing together stakeholders. We're hoping that counties are bringing together stakeholders, working with their local REMSCOs to say, hey, who else should we have at the table in drafting these plans and things like that, and bring in those people who are essential to making this plan a good plan, and then looking at what that future is and what it does. And I think when we look at Ulster County, you see how much a county can do without having to be an EMS agency. There, without having to have an ambulance out there that says Ulster County EMS on it. That doesn't exist. There's partnerships and agreements and things that can happen that can build and support that system without having to go down that route. And there's a lot. We have 1,000 EMS agencies in New York State. There's a lot of EMS resources, and it's just about looking right now at how do you strengthen it, how do you bring it all together.
Thank you. How will the state identify providers that live outside the county and commute in, or providers that work in multiple agencies so there's no duplicates? Brian.
Yeah, that's a great question. So unfortunately, the way that we have it today, we can only identify it based on where they live. And we made that pretty clear to the County EMS coordinators that the information we're going to provide with providers and EMS agencies, or where, kind of how many providers are in a county, will be based on where we have them recorded as their home address. It will not be necessarily based on where they live. So we know if we look, in New York City, that there's a lot of EMS providers that come from the Hudson Valley, from Long Island and Nassau and Suffolk. They'll be, shown on the reports as where they live, not necessarily where they work. And that's just one of the things that in the future, we think we'll be able to get more to where they work and be able to show that. But currently today, and particularly in this timeline, we'll have to do it in a slightly different pathway.
Okay, thank you. Let me ask County Executive Metzger and Everett back to that issue of the PSAPs. County Executive Metzger, did they just voluntarily give them up? What do you remember or know when that change happened in the past? Because some counties have multiple PSAPs throughout the county. Some counties have gone through a single streamlined one. Do you remember or know what happened to the town-based PSAPs system?
So I was on my town board then, and I certainly don't remember it being that controversial, but I'm going to let Everett speak to that because he will know more of the history.
So, back in '93, that's when we went to enhanced 911 here in Ulster County. But we never had a large amount of PSAPs. Our cellular was going through the state police, and we have a couple agencies that do have a couple law enforcement agencies that do have their own dispatch, but most of our 911 call, all our 911 call volume comes through us. So anything fire, police, and EMS that is an emergency 911 just goes into our center. We don't split it anywhere. It comes down to coordination. It's very hard to coordinate multiple PSAPs. So back then, that group that was in charge of that, putting that together, which Michael's not on here with us, but Michael Beninati was part of that group. Actually, that's how long he's been with us. So he helped to bring everyone together. But I saw who asked the question, and I can get some more information and provide some insight on what we did back in the early 90s.
Okay, thank you. A couple more questions, and then we'll wrap it up here. Director Greenberg, does the state do current state statutes allow a countywide EMS district?
So it doesn't allow it, and I assume that they're talking about a taxing district, and I'll let Alyssa touch on this one. But if it is related to a taxing district, I don't believe that's currently allowed. I think we've seen that in some past legislation, but it hasn't passed. If they're referring to a county EMS CON, we do. And we've seen just in the time that I've been here in my role for the past 8 years, a pretty significant number of counties obtain a county CON, a certificate of operating certificate, and they do that for a multitude of different reasons. We see some counties putting out paramedic fly cars. We see some counties, putting out mutual aid ambulances. We see some counties, again, like Ulster. Sorry to keep pointing to a great example, but helping, getting that certificate in order to help coordinate resources and allow resources to move in different parts of county that they otherwise wouldn't. So kind of that's it from that side. And like it's been said beforehand, we're always happy to have a conversation with counties about what some of those options are, what it looks like, and what it means. I would encourage any county that does have questions on that to reach out to Alyssa's office through the Office of Governmental Affairs, and she can coordinate with that and then make some of those conversations possible. Alyssa, anything I didn't touch on there?
No, agree with everything you said. Thank you.
Okay, to wrap up, has the state provided the EMS coordinators with the data and information they have, such as a certificate of need that we've stated multiple times throughout this recording? Just some clarification is needed. Has that already been provided, or when will that be provided?
Yeah, so if you're referring to through the presentation, you heard me talk about we're going to provide certain data points, different things. It has not been provided yet. My expectation is that will probably happen in the early part of September, that we'll be getting that out to each of the counties, maybe a little bit later, depending on what the counties are asking for, if there's some different information that they want or things like that. But the agencies, the provider numbers, those things, we're expecting in that first part of September. The EMS agency data is happening live. So as we get the data information, the second that the agency hits send, it goes directly to the County EMS Coordinator as well as to us. So if there is any information, let's say that I never got something from this agency, we'll be able to go back, confirm it, and say, oh, here it is. We'll be able to provide that too. So that information is all forthcoming, but none of it has been provided yet.
Okay, last question, and I promise. Flexibility on the deadline. Thoughts about flexibility if counties can't exactly achieve that exact December deadline?
Yeah, the statute is written the way a statute is, which is, enacted on June 19th. Deadline is December 19th. And, we're talking several months away. We, provide a framework. We're going to provide the Word document of that framework too, because some counties said we really just want to work within this framework, kind of even more. We're encouraging everybody to aim for that December deadline, as that's what's there. We're also, from a state point of view, really trying to put a lot of resources into supporting the counties. You see two of our task force captains today on the call, Brian and Chuck, who are doing tremendous amounts of work, and thank you to each of you for all the work that you're doing. But the department is really trying to support the counties in whatever way we can to help them achieve that goal, to help them, achieve that report. And, we just want to remind everyone too that this should be a living document, that, the goal would be aim for that December 19th, have that report in, get what you can into it. If it needs to adapt or change or grow or whatever after that, then that's excellent. Right. That's the goal of this. The goal is that, you put in there, you have your expectations, maybe some short-term and long-term goals, and maybe you revisit it in 2 or 3 years where you come back and say, hey, now we've done these things. Wow, look at the system now. I know Ulster County is going to have to update theirs, because in the next 2 to 3 years, they're just going to see change and progress, and in a good way, in the way that we want to see. And so this is an excellent opportunity to engage your community, engage your stakeholders, engage your EMS agencies, but not just your EMS agencies, engage your municipalities, your local, officials, as well as your community members, to figure out what it is that they're looking for, and also that they understand what the system is today and kind of where it's going into the future to help do it. We're really excited about this in the department. I just want to say thank you for having us today and for this, and also not just us, but the Ulster side showing, some of those models. It's just a, tremendous work, and county executive and commissioner, really appreciate everything that you're doing. Think outside the box, ask questions. We're here to help, Everett had said before, or to at least, bounce ideas off of, bounce things. And in some cases, just to point you to another county. And I mean that in a really good way. We've had counties that have come to us and said, hey, I'm thinking about doing this. Has anyone done it? And I've said, oh, you need to go talk to this person, or you need to go talk to that person, because there's a lot of counties in the state, and NYSAC does an excellent job of connecting all these different ideas and things like that. We hear about different things. If we can ever help in just sharing names of people, because I will tell you, one of the best parts about this has been people really want to share. The county coordinators are really about how do we share with one another what each are doing, so that we are not recreating the wheel over and over again. So just want to, say thank you for that one, and, take this opportunity to really help grow the system into the future.
Thank you, Ryan. Thank you to all of our panelists today. If you have further questions on this topic, you can email NYSAC at info@nysac.org. That's info@nysac.org. Thanks, everybody, for all your time and attention for a great presentation today. Have a great day.
Bye now.
Thank you.
Take care. Thank you.